Hi everyone, my name is Linda Narito, and I would like to talk to you guys about a solution to the healthcare epidemic we have in the country. I think this solution would fix the corrupt system that we have today. So I'd like to first off premise with the healthcare epidemic. What I mean by this is that there are so many problems in the healthcare that we have today, and millions of Americans are going without it, and I do believe this is a huge problem and it needs to be fixed immediately. So almost 1 in 5 Americans are going without health care, and this could be due to high prices, problems obtaining coverage. It could be the status change or other reasons that some Americans have, and I will go over all of them on the next slide. Not having health care can strip Americans of getting prescriptions, eyeglasses, or other major services that we need. And unfortunately, there has been a devastating growth in the number of people who are not having health care. This picture to the right shows the percentage of uninsured individuals under age 65, and it shows that it will continue to rise over the next few years. So as you can see, the actual right here has happened, and this is from 2016, as you can tell. And in the next 10-ish years, it is projected to get higher and higher, which is just devastating. So like I said earlier, here are some reasons for people living without health care. The largest reason is because the cost is too high, and that covers about 45% of individuals who cannot obtain it. Lost job or changed employers comes in second. They lost Medicaid, a status change, an employer does not offer or ineligible for coverage, or believe it or not, 2% of people think they do not need coverage. So what I want to talk to you about this is eliminating the high cost of healthcare will cater to almost half of the American population living without healthcare. Some prior solutions that have been enacted is the Affordable Care Act. This was passed by former President Barack Obama in the year 2010, attempting to reduce the amount of American citizens living without healthcare. A few of the disadvantages or cons of the Affordable Care Act or Obamacare is that it did not reduce deficit. Plans were canceled for over 1 million Americans. It created a difficult transition to hospitals. It raised deductible levels, and it led to a historic decrease in uninsured rates across the nation. So the proposal I have for you guys today is a universal healthcare system. What this system would do is grant medical services to every citizen at an affordable cost. This would guarantee equal and quality services to citizens regardless of their ability to pay. It would provide protection for citizens in terms of their health, and it would standardize billing procedures. What I mean by this is that doctors would be dealing with only one agency instead of different private health insurers. This would create a healthier and easier workforce all around. And I did want to mention 32 out of 33 developed countries have this system in place, some of these including France, Germany, and the UK. So the pathways to universal health care. I think the first step that we would need to take is to propose again and expand the State Child Health Insurance Plan, or the S-CHIP, vetoed by Bush, to about 5 million children. The S-CHIP was a partnership between the federal and state governments that provides low-cost health coverage to children and families that earn too much money to qualify for Medicaid. This would cover at least 96% of children, and once every child is protected, I believe the foundation for success is laid. The next thing to do is to test the effectiveness of medical services, to get states on board, and I think once one state is on board, it would create a domino effect, and most states would continue to enact it, and we would get closer to getting a universal healthcare system. Finally, we should create a national health insurance clearinghouse, which would regulate how health insurance is sold and regulate health insurance prices. The national clearinghouse would be a channel for all people to get coverage. So as for the feasibility, citizens will pay for universal healthcare system through their taxes. Use of advertisements and the media will need to be mandatory, and as social media is taking over the country today, I believe it's extremely important to get our point across and hear other opinions and ideas to solve the universal healthcare, the healthcare epidemic crisis. We would need to collect large pools of prepaid funds that can be used to cover the healthcare costs regardless of those in need or their ability to pay. And in this image right here, you could see there's free and universal healthcare in more than half of the world, and as you could see, America and parts of Africa have no free or universal health care. I think it's extremely important to act now, because if the percentage of uninsured Americans continues to increase, millions of our citizens' lives will be put at risk. Thus, this would corrupt children by raising them in a botched healthcare system. This must happen immediately to save our country, and we need to give citizens what they deserve. Most people think that healthcare is a political controversy, but I, for one, do not, because it is people's lives and it does not need to be a side of an argument, if you will. So I really hope that you guys take the universal healthcare system idea and proposal and their advantages, and I hope you guys think about it and maybe spread it around and do some research and really try to help save our country like I am trying. Thank you guys.